Well, good morning. Welcome to Coffee with Kate.
Thank you. Good morning.
So I'm thrilled to have Dr. Sarah Reed from the Reproductive Sciences Center of the San Francisco Bay Area. And we're going to talk about a very important topic, donor gametes, donor eggs, donor sperm. Can I borrow some gametes? All of that good stuff. So welcome, and let's just jump right into this.
Great.
I know this is a big part of Dr. Reed's practice, so she knows a lot about this topic. Tell me a little bit about what donor gametes are. What is donor egg and donor sperm?
Yeah, great question. So donor gametes are essentially when you use either sperm or eggs, those are gametes, sperm and eggs, that come from a third person. So somebody not necessarily in your partnership or in the couple, to help you grow your family. So donor sperm could be used by either a single person who doesn't have a partner, somebody whose partner doesn't produce sperm, or somebody whose partner has like a medical problem where the sperm quality is a challenge. And then donor eggs, similarly, could be used by a single person who doesn't make their own eggs, somebody who has a partner who doesn't make eggs, or for somebody whose egg quality isn't allowing them to conceive using their own eggs.
So tell me a little bit about how egg donors and sperm donors are selected and how people are weeded out who may not be good fits for that.
Yeah, so the process is actually pretty strict.
Okay.
And I just talked to a patient yesterday about this who was thinking about using a known egg donor to have a baby. That process is a little different. We can kind of touch on that. But when you're using, you know, what I call sort of like a professional egg donor or sperm donor, I used to say anonymous, but that term does not really exist anymore with
23andMe.
Yeah, not with 23andMe. So when you're using a donor from a bank or a clinic or some professional fertility organization, they will have gone through a super strict screening process. It starts with an interview, you know, who are you, what's your story, what's your general health, and then if they've passed that step, comes to a physical exam, which is looking for signs of medical illnesses, infectious diseases, or things that could lead to risks for infectious disease, like sort of new tattoos, lots of piercings that maybe weren't done professionally, things like that. And then also a blood test to look for specific infectious diseses that could potentially be passed on through the gametes. So that's one step. Then
what blood tests do they screen for? What?
So hepatitis B and C, HIV, something called HTLV, which is kind of in a similar vein, and then syphilis and gonorrhea, chlamydia. So
and I'm
all
wondering,
those infectious diseases are done.
So I'm looking at, you know, we're in the days of COVID-19. Is that something you think at some point they may be looking for antibodies for, or that may be involved somehow?
Yeah, good question. At this point, we're not. So all the guidance that we get from our professional organizations that look at this have not yet recommended testing for COVID. They've recommended sort of a symptomatic screening approach. So if a donor had a risk of an exposure, say they knew they were around somebody, or if they had any symptoms, then we'd probably hit pause, sort out whether or not they were ill or not. And then once they're clearly recovered or clearly not ill, then they would move forward. So at this point, it's more of like a pause if that was going on. So the infectious diseases we're testing for are the ones that the FDA requires we check. And so that's a specialized FDA laboratory and a specialized FDA exam to look for signs of any of those infectious diseases.
So tell me, you mentioned before the difference between known donor and an unknown donor. My next door neighbor, if they're willing to let me borrow some eggs, would be an example of a known donor because I know the person and I'm bringing them to you, my doctor. An unknown donor would be someone who I found after looking through a database, and I said, I want somebody who kind of has this eye color, this hair color, this background. So how are the known versus the unknown donors screened?
So we actually do fairly similar screening. If you came to me and said, my sister wants to donate eggs to me, I would call your sister, talk through her medical history. We'd eventually bring her in for the same physical exam. We could potentially add genetic screening. We would do some fertility testing. So all the things that an unknown or an anonymous to you donor would go through to, again, make sure that they're a good, healthy candidate. It's going to give you a really good chance of being able to achieve your goals by using the donor egg or the donor sperm, but also that it's going to be a safe and healthy situation for the donor. In a known donor situation, one extra step that we also take is a psychiatric consultation. So anonymous donors go through a screening process to look for signs of any psychiatric disease or concerning symptoms that there could be something that could pass on. But
Yes.
for a known situation, we actually want to dig into the relationship a little bit to make sure that this is going to be a positive for your relationship with that person. So particularly if it's a family member, it might sound really nice to take your sister's eggs and have a baby, but we do want to explore, is that going to be a positive thing for your family, or could that cause tensions where maybe that's not the best option for your family? So it's not like
I
a
understand.
fitness test to say like, are you going to be a good parent or anything like that? It's more to say, is this going to be healthy for you and your family or for you and your friend?
And so there are times where with a known donor, you would say, we would not recommend.
Sure. So I've definitely had people come to me and bring me a family member or a friend. And when we do the medical screening, we say, you know, the odds of a pregnancy resulting from this cycle maybe aren't high enough. You know, maybe the donor you brought to me is older than we would advise.
Yeah.
Or when we look at their egg count, it's lower than would likely yield a good response. So there are situations where we might say, we don't know how good a scenario this is. But ultimately, there may be so much added value to that person in knowing their donor that it may be worth it. So it's a conversation.
Yeah.
There's never like a line in the sand.
Got it. Got it. So tell me, what does this process look like for both the egg donor or the sperm donor and the recipient? So your patients, let's say they picked their person, whether it's known or it's unknown. What does your patient do, the person with infertility? And then what do the donors do?
Yeah, so we'll cover sperm donors first because that's a little easier.
Okay.
So the sperm donor goes through the evaluation process, and then they provide samples. So they would ejaculate a sample of sperm, we would wash it, prep it, freeze it. Oftentimes that's also done in a sperm bank. So sperm banks are really good. They do all the screening, they collect the samples, and then they hold the samples. And then if somebody wants to use them, they just purchase them directly from the bank. So sort of all that upfront work is done.
Okay, so then you all don't have to do anything other than say, this patient has picked donor number 123.
Exactly.
And they would send it to you, and then
Exactly.
got
And
it.
then depending on the treatment that the person intending to get pregnant is going to go through, whether it's insemination, putting the sperm inside the uterus, or whether it's IVF, taking the eggs out, putting together with sperm in the lab, and then putting them back in the body. Either of those processes would just carry out the way they would for any patient going through those treatments. But at the moment we need the sperm, we're thawing the vial and using that donor sperm.
Okay, all right. So what about eggs?
So with eggs, it's a little more complicated. So in order to get the eggs, the person donating has to go through an egg retrieval. So they go through the stimulation process where they take the injections for about 10 to 12 days to grow the eggs. We monitor them, and then the eggs are removed. And in the past, we mostly did what we call fresh donor cycles, where the eggs would come out, they'd be fertilized that day, and then the process would go forward. What we're doing more and more now is frozen donor eggs, where they're banked, much like a sperm donor. So we've all heard about egg freezing for fertility preservation.
Yeah.
That's actually led to a huge opportunity for people using donor eggs as well, because the donor can cycle when it's convenient for her. We can retrieve the eggs and then freeze them. And we freeze them in little groups called lots, L-O-T-S. And a lot may have 6 eggs, or it may have 8 eggs. And then a person who wants to use those eggs can purchase a lot of eggs and use them. And then they're ready when they are. So we thaw the eggs, we fertilize them with either partner sperm or donor sperm, and then we can go forward with the transfer. So
how are the
it adds a lot of
outcomes?
flexibility.
So flexibility is excellent and crucial, but how are the outcomes for the frozen versus the fresh
Yeah,
eggs?
awesome question. So 5 years ago, I would tell my patients that fresh eggs give us a 70-75% pregnancy rate and frozen was 50-55. But as the technology for egg freezing and thawing has improved, and as we've gotten better at identifying who's a good candidate to be a frozen egg donor, and
Yeah.
we've gotten better at storing and handling them, those success rates are now even. And in our center for the last 2 years, we've had our best pregnancy rates actually with the frozen donor eggs. So I don't think you're compromising your success rates as long as you use good quality eggs at a center that's experienced with it by going with frozen.
So, and this is a little off topic, but I'm going to ask it anyway. Given that the outcomes are better with the frozen, would you, even if you were going through IVF with your own eggs, potentially say, we're just going to freeze them for a couple of days and then come back for your transfer if the outcomes are that much better?
So two things that come up here. Sometimes we talk about freezing eggs and sometimes embryos. So for the donor egg standpoint, we're talking about previously frozen eggs versus fresh eggs.
Yeah.
Still almost always doing a fresh transfer. And those pregnancy rates are the same. And just maybe by luck, but in our center lately, a little better with frozen eggs.
Got it.
Fresh versus frozen embryos, which was what we're usually talking about in somebody's own IVF cycle using their own eggs. It's going to depend a lot on your individual clinical situation, whether there's a benefit of one versus the other. But unless there's sort of a real specific reason, I very rarely have my patients who are using their own eggs freeze them as eggs, then thaw them, fertilize them, and then proceed.
Understood. So less kind of mucking
Less
around.
manipulate. Yeah.
Yes, yes. Okay, that's good. That's good. So who would be eligible for donor egg, donor sperm? Do you screen the patients to say, well, no, we don't think you would be a good donor egg or donor sperm candidate? Or is it just based on them coming in and saying, you know, I think I would like to use donor egg, donor sperm?
Okay. So there are sort of the obvious scenarios where somebody needs to use donor eggs. So if I'm working with either a single male or a couple where both partners are male and nobody makes eggs and nobody has a uterus, then we have to use an egg donor. So that's an obvious situation.
Yes.
Another common situation where people use donor eggs is where we have a female patient who either doesn't have ovaries anymore or doesn't make eggs of a high enough quality or high enough number to give herself a good opportunity to conceive using her own eggs.
Understood.
So it may be someone who's gone through treatment like chemotherapy, or it may be somebody who went through menopause early, or perhaps it's somebody who has tried multiple rounds of some type of fertility treatment using their own eggs and has been told the chances are low with your eggs, but with donor eggs, the chances are better.
So what I've seen more often than not, when there is an issue with using donor eggs in the Cade Foundation Family Building Grant process, is people who have, women in particular, who have been told the likelihood of you conceiving using your eggs, your own eggs, is very low. And if you use donor eggs, the likelihood of you conceiving is higher.
Mm-hmm.
You know, sometimes much higher. So you might have a 1% versus a 70%.
Right.
But have you seen that in practice as well?
Certainly, we see it a lot. One of the main drivers of that difference is age. Unfortunately, ovaries age faster than the rest of us. So you may be a perfectly young, healthy person, but for almost all of us, late 30s to early to mid 40s, the egg quality just starts to decline. Even if you've done everything perfect, we haven't figured out how to outsmart that yet. So for a lot of my patients in their 40s, if they're not responding well to fertility treatments themselves, the best way to boost their chances is to use an egg donor. And egg donors are typically under age 30. So they're in that age group where egg quality is at its peak. You know, where the chromosomes are normal in the eggs and the quality is really strong and the number is really strong. So that's really where that boost comes from.
Well,